Okay.
The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and thank you for joining us for our webinar today, part of the Hot Topics in Genetics and Advocacy category. My name is Natasha Bonham, and today we will be discussing what's new with the Newborn Screening Clearinghouse. In addition to myself, we also have Leni Simon, who will start us off. She is a public health analyst for the Maternal and Child Health Bureau, part of the Health Resources and Services Administration, part of HHS. And just to remind everyone that we will be taking questions at the end of the meeting, or at the end of the presentations, but you can use your panel. Just click on the questions section, and we'll be taking in questions throughout the day, throughout the presentation. But you can just put in your questions in that little section, and we'll be sure to respond to it. Also, throughout the presentations, we will have two polls that pop up. The best way to handle that is just once they pop up, send us your quick little answers, and then once you click your answer, the poll will go away and you'll be able to see the screen once again. And we'll let everyone know about the results of that at the end of our discussion. So without further ado, Leni, please take it away.
Thank you, Natasha. Good afternoon, everyone. As Natasha mentioned, I am Leni Simon, and I'm a public health analyst and the project officer for the Newborn Screening Clearinghouse. Before Natasha's presentation, which will provide you with the work plan details and status of the Newborn Screening Clearinghouse, I will provide some brief introductory comments on the federal agency that is supporting this work. The Newborn Screening Clearinghouse is a cooperative agreement funded by the Genetic Services Branch. The Genetic Services Branch is part of the Division of Services for Children with Special Health Needs. Our division is one of 5 divisions within the Maternal and Child Health Bureau at the Health Resources and Services Administration, an agency within the Department of Health and Human Services. And I've provided this detail on where the Genetic Services Branch lies within the federal government to provide a little context on the organizational structure and policies that guide and shape the programs that the Genetic Services Branch funds. I encourage you to learn more about the Maternal and Child Health Bureau programs and activities that may be of interest to you by visiting the Health Resources and Services Administration website at www.hrsa.gov and selecting the Maternal and Child Health tab. The Newborn Screening Saves Lives Act 2008 is the federal legislation which the Newborn Screening Clearinghouse Cooperative Agreement is in response to. It is one section of this legislation which seeks to work across the newborn screening system to improve newborn and child screening for heritable disorders. And it is a central component of the work of the Genetic Services Branch as well as the work of the Secretary's Advisory Committee on Heritable Disorders in Newborns and Children. So we see the clearinghouse as being a central part of that work. The Advisory's Committee charge is to provide advice to the Secretary of the U.S. Department of Health and Human Services about aspects of newborn and childhood screening and technical information for the development of policies and priorities that will enhance the ability of state and local health agencies to provide for newborn and child screening, counseling, and health care services for newborns and children having or at risk for heritable disorders. Again, the Newborn Screening Clearinghouse will serve as an informational channel and link between the stakeholders at the national, state, community, and family levels and the Secretary's Advisory Committee on Heritable Disorders in Newborns and Children. And that's one of the aspects of the clearinghouse, is to be that conduit and channel. Specifically, the Newborn Screening Clearinghouse is envisioned as an internet website that serves as a central clearinghouse of current educational and family support and services information, materials and resources, research and data on newborn screening to increase awareness, knowledge, and understanding of newborn diseases, of newborn screening, screening services for parents and families, health professionals, industry representatives, and the public in general. So I will conclude by saying that the Newborn Screening Clearinghouse can play an integral role in furthering the progress of the newborn screening system by serving as an information and educational resource. And the Genetic Services Branch looks forward to the continued development of the clearinghouse. And I look forward to your comments and thoughts today and throughout the development of the clearinghouse. And now I'll hand the session back over to Natasha.
Great. Thank you very much for that, for really kind of setting the stage for the conversation today. So we will go and talk a little bit about what's new with the Newborn Screening Clearinghouse. Great. So now everyone should be able to see my screen, my slides. So first, I'm not going to go all the way in detail with this, but this is just a reminder for discussing what the vision of the clearinghouse is supposed to be. If this is the first that you are hearing about the clearinghouse, welcome. We have some other webinars and materials within our resource repository, which is at resourcerepository.org, discussing the clearinghouse, where you can get some background. But we'll talk a little bit about that on this call today. So like Leanie said, really the vision for the clearinghouse is to connect parents and healthcare providers with the resources and information that's out there. We know that in states as well as in the HRSA Genetics Collaborative, a lot of really great resources and information has been produced. And this is a forum for allowing the connection between the people who need the information and those producing it. By doing that, we see that there will be an improved understanding about what newborn screening is, as well as more informed decision-making around what types of screens people should be getting or how they would like to handle that. It's also part of the clearinghouse is to really facilitate that information sharing. We know that there are many really great models out there around information and resources, and the clearinghouse is meant to help people see all the different models out there for educating families, educating providers, and so that people can really share those models across the country and amongst the different state and programs. There's also a component of enabling data transparency, really looking at, there's, again, along with the information materials, a lot of data out there, and seeing what can be done through the clearinghouse by having certain efforts put into that, paying attention to data, and seeing what can be done for data transparency and really being able to support all the great work that the state programs do along those lines. Also, there is a component of the clearinghouse site that will provide information on federal funding for newborn screening, and also really to understand the interface between public health and healthcare delivery systems. So the newborn screening clearinghouse is more than just a website. There's a whole program behind it. At the end of the discussion today, we will do a quick little tour of the clearinghouse. So that will kind of highlight some of the pieces of this vision that we have already started working on. As Leanie mentioned, there is the Newborn Screening Saves Lives Act of 2008, which mandated that this clearinghouse be established. The base requirements are that it is centralized and online, research-based information, also information on each state, an interactive forum, data, and dissemination. Those are all key components to what the clearinghouse is to do. And really, this slide is really to mention that the clearinghouse is really going to pull together, all the really great work that established organizations have done, both at the federal level, the public health perspective, and laboratory groups, and really match that up with all the great technology that is out there, whether it's Facebook or blogging, Twitter, receiving messages through texting. These are all the ways that people today are getting their information, not just their fun social information, but also their health information, and really to see how can the clearinghouse connect all the great work being done by the organizations on the right side of the screen, connecting that to people through the means that are represented on the left side. So some overarching issues that have come about since we started discussing the clearinghouse, and as a reminder, the clearinghouse was awarded to Genetic Alliance in the fall of 2009, September 1, 2009. We've had a number of different meetings with our National Advisory Committee as well as other stakeholders, and these are some things that have come up that we are really looking to address. So first, prioritization of information and quality filters. This is something that we're dealing with on many different levels as there's more information coming out, not just about newborn screening, but about genetics, health in general, how do you know what information to look at first? How do you know what you're looking at is really a quality? That's something that not only are professionals in the field dealing with, but it's also a key component of what makes a lot of health information confusing to the general public or to families who really need to get to that information. Part of the clearinghouse, we are establishing a materials working group that will really focus on not just on how are materials created, but really specifically on policies that should be implemented around materials. What should the structure be for the clearinghouse to make sure that if someone from California needs information and they go to the clearinghouse, how can we structure it so that they get the most applicable information for them, making sure that their state information is first, that the people who are local in California or even just in their region in California who really know the newborn screening system, those contact informations are up first. So that working group will work to kind of hash out those different components. Also, the clearinghouse has a role for consumers and primary care providers, and not just in that the clearinghouse is going to be pushing out information to them, but also needs to get feedback from those groups. So consumers and primary care providers will be included in the development and testing of the more official final site. The site that I'll be showing you today is definitely more in a beta version in terms of getting something up there. It's always easier to give feedback on something that's present as opposed to getting feedback on something that's just conceptual. Also, the Newborn Screening Clearinghouse will be a place that does a lot of public education around newborn screening and incorporating many different interactive components to do that. So talking to the public both about newborn screening as a system, but also, why is it important for families to know about newborn screening? Why are these screens being done? And really all the really great stories that come out of families and children whose lives have been saved or altered for the better through newborn screening. There also have been a number of questions around, will the clearinghouse discuss international issues? Now, while the clearinghouse really is primarily a resource for the U.S., it's, no program and no one really lives within a vacuum. And so as we are going through different variations of the clearinghouse, we will be looking to see how can an international perspective be included, always remembering that the core audience is a U.S. consumer and provider base. Also, I'd like to talk a little bit about our activities for year one. So the project is a 5-year project. We're still in the first year, so there's a lot of time to get feedback and to incorporate new variations of the site. But we launched the beta site in October 2009, and we've already done one redesign, looking at laying out the information so that it's a little bit cleaner, nicer lines, making it more accessible to people. But we still see this as the Clearinghouse 0.9. We really are looking forward to being able to take the feedback that we've heard so far and also what we've been hearing from you and from the general public to really improve what we're doing. We have also done a presentation to the Secretary's Advisory Committee on Heritable Disorders in Newborns and Children. So we did our first presentation to that group in January. We also did a smaller presentation to that committee's subcommittee on education and training just last week. Again, really trying to be very transparent in the process of how the clearinghouse is going, the different components that we've added, getting feedback from people. Also, as a side note, you should have seen a little pop-up on your screen with our first poll question, which is, which feature of the Newborn Screening Clearinghouse do you find most useful? And you can choose only one option for this one. Please click whichever one you think would be most helpful or most interesting. I'll show you all 4 of those, which is the quick links, featured resources, our blog, and we also have a small video. Once you click it, the pop-up will go away. So back to these slides. So again, by the end of this first grant year, which will end August 31st of 2010. We will be more underway in the construction of the new versions of the Clearinghouse 1.0, 2.0, etc. And also we have been assisting in community engagement around data issues. That's something that I'll go into a little bit more detail in the next slide. So there are many things that the Clearinghouse will link to and also will have within itself, such as a blog, video feeds, RSS feeds, things of that nature. But there's also work being done on behalf of the Clearinghouse. So as a active partner in the entire newborn screening discussion, one of these pieces really has to do with looking at what are the quality indicator needs and looking at, as we go into the future where there'll be health information technology and health information exchanges, what can we as the Clearinghouse, and that's we in terms of Genetic Alliance, we as with our partners such as HRSA, the regional collaboratives, and also we as a newborn screening community do to really improve or to further evolve how we're looking at data and quality indicators. The start of this really was the workshop that we had at the Association of Public Health Laboratories, their Newborn Screening and Genetic Testing Symposium, which was just about 2 weeks or so ago. We had approximately 130 people, and this is really, again, the start of a multi-year-long process with HRSA and other stakeholders looking at the needs from a quality indicators perspective. We did discuss a number of different topics, but some things that came up were really from people who work at the state level and really are kind of in the trenches of newborn screening. If we're looking at the idea of standardization across programs and what are the things we should be measuring in terms of quality indicators, the need for consensus of definitions came up. Also figure out who is going to make the decision about what definitions are regarding what counts as a condition and what doesn't, what is labeled something else. Also, there was a lot of discussion about the recently released National Library of Medicine Coding and Terminology Guide in terms of its inception and incorporation into newborn screening programs. But some really overarching themes were state programs serving state needs in regards to newborn screening, and that compared to a national health agenda. And sometimes that is one versus the other. I think really moving that into how can one truly benefit the other, and how can we get dialogue going on from at both the national level and state level, so that there's a really nice flow of information and effort between both national agendas and state programs. There really is going to be a tsunami of health information technology infrastructure, particularly since that is a place that the current administration is very actively involved in and is very excited to see. And the fact that newborn screening is a really great model for looking at coordinated care and how can health information technology be implemented to help really coordinate that care, again, at the state but also regional levels, and how are state programs going to handle that, what will be the ramp-up time to that. So we had a lot of questions and discussion around that. Also the issue that resources really do need to be carefully evaluated and capitalized upon, and that's really a range of resources, whether that's materials, that's resources to parents, resources particularly to states in terms of establishing more HIT infrastructure in their programs, really making sure that as certain mandates come out and suggestions, recommendations come out, that there is appropriate support for that and appropriate communication around those new programs and new initiatives. And again, really for states, it was the coordination of care is most important, and the fact that it is very complex across the system. And how do we deal with these complex systems and really make sure care is coordinated so that no baby, no family falls through any gaps, and that all the children can really get all the best that newborn screening has been able to provide for a number of years now, for decades now. So now I will take you through a short little tour of the Clearinghouse site, which can be found at nbsclearinghouse.org. And here we go. So this is the front page. As you can see, we have our featured resources in the center. Right now we're highlighting Peristats of March of Dimes, but there are a number of other resources available, things that are specific to parents and providers, as well as the NNSIS, where people can go and get real data around newborn screening. We have this site showing the funding opportunities, which is something we're still building up to have that be something that's very nicely coordinated with grants.gov. You can also get information on condition-specific groups as well as from HRSA. So those features rotate right here and also are on the side over here where people can click. One of our recent additions is our blog. So we can go to one of these, which is just the first one, which was the Welcome to the Newborn Screening Clearinghouse. And this gives a nice outline of what the clearinghouse is, why it's important to have information available to people around the clearinghouse, being able to, you can log on, and also you can register to post comments. We really want this to be a dynamic forum where people can give their input, raise questions, and really have a conversation around newborn screening and all the multiple components of that, from the technical screening side of things to also short-term and long-term follow-up, as well as just general public curiosity. The site is a blog we will be uploading every 1 to 2 weeks, getting on a schedule now, but any feedback that you have, we'd be more than happy to listen to. Right here is really the blog guidelines, and it really talks about that this is an open space for public dialogue on newborn screening and other issues. And we want the conversation to be transparent and really to encourage free dialogue, but also to be very respectful. We would love to hear questions or comments about the newborn screening system, but we also want that to be done in a respectful and open manner. And we have our frequently asked questions, which really talks a little bit more about the clearinghouse, the people involved in it. We've had some questions about if blood spots will be stored in the clearinghouse. No, it will not be, but we hope to really engage the public in conversations about blood spots, screening, access to information, all those great topics that fuel conversation in the newborn screening community. Over here is a video that I will not play, but please feel free to click on that. It is a video, a compilation of small interviews that Genetic Alliance did during its December 2009 summit called Envisioning the Future of Newborn Screening. And it's just a very nice introduction to some key questions of newborn screening in terms of what does the future look like, what should we be focusing on, and it has a lot of really, a range of really neat stakeholders in that space. But, so this is some of the updates for the Newborn Screening Clearinghouse. That is the end of the presentation. I think we have one more poll that will pop up on your screen momentarily, but we really are now open for questions, comments, anything that people would like to discuss through the webinar panel. And again, you just have to click on questions, and you can type in your question and we will respond to them. And the poll that we have currently up is, which topics would you like to see featured on the Newborn Screening Clearinghouse blog? This is a new endeavor for us. It's been up only a couple of weeks, but we are starting to pick that up and really want to have that be a very nice forum for active discussion and up-to-date information. So currently, in terms of the poll, we can see what people are clicking on as we speak. What we have ahead of the game right now is news stories or hot topics in newborn screening, but following closely behind that is highlights from the Secretary's Advisory Committee meeting. And we actually will have a blog posting about that from a consumer who's never been to that meeting, and the May meeting was her first meeting, so we're really looking forward to having that conversation be active. So one question that we have that just came through is how will the Newborn Screening Clearinghouse help to understand the interface between public health and the healthcare delivery system? And that's a really good question. I'll take a crack at it, and then I'll ask Leanie to also give her perspectives on that. But having a place where health information can be presented, and from a systems perspective, like the healthcare system, be presented, but then also having mechanisms in place for people to discuss the public health components of that is really important to really pull those pieces together. So some ways that will help to understand that is through the blog, but also other reportings that would come out of different meetings throughout the newborn screening community. We really are looking for a way to have in addition to active conversation and dialogue, but really up-to-date, relevant information up on the clearinghouse. So we will be linking, as you can see, we link to a range of resources and looking to expand that, to expand what we are linking to from a perspective of public health, from the perspective of different regional collaboratives, so that there's more transparency and more understanding about, what is this healthcare system doing in terms of newborn screening, and how does that affect the children that are born every single day. But Lainey, I don't know if you want to address the question, do a quick recap of it, which is how will the Newborn Screening Clearinghouse help to understand the interface between public health and the healthcare delivery system?
That's a very good question. I would just say that having the stakeholders that are fueling and interacting with this newborn screening system itself, and having them talk about what the issues are with interacting with the public health system, what the needs and opportunities are through the blog sites, through requests for, I guess, research or additional information on what the literature is saying about the system itself could help to further that understanding. So, whatever materials and information are posted, and whatever the stakeholders within the system, ask to be further described, that the clearinghouse will be responsive to that. And since you've just, the person who's just asked that question, this is being recorded by the cooperative agreement awardee, so to know that that is a concern, that is an issue, and to continue to collect all the questions and issues that the users, the members of the community think are important or that should be raised, and trying to make sure that the clearinghouse will address it. So just by individuals participating in events like the webinar, like the blog, raising these issues, the awardee Genetic Alliance will be paying close attention to that, and trying to have the clearinghouse address those questions.
Yep, great. So our next question is, how are you coordinating with the states? And we're doing that on a number of different levels. So first, we are one of the main partners of this project are the HRSA genetic collaboratives, formerly known as the regional collaboratives. And we're working very closely with them. There is a representative from each of the collaboratives, and there are 7 in total. And a lot of newborn screening and genetics work done at the regional level is coordinated through those collaboratives. So we have a representative from each of those genetics collaboratives on our National Advisory Committee. Also on our working groups, there is a representative of a regional collaborative, at least one regional collaborative on those working groups. We also have engaged in a number of different discussions specifically with those collaboratives, both at their regular meetings, as well as Genetic Alliance and the Clearinghouse hosting specific meetings to really understand what are the issues, what is already being done at that level so that there's no copying or duplication of efforts, but really linking to the great resources that already exist. We also, another primary partner in this project is the Association of Public Health Laboratories, and that really gets even further down into the specific state departments of health and the state newborn screening programs. Again, really being able to understand the key issues that states are dealing with. That it is through that relationship with the Association of Public Health Labs that we were able to help host the workshop that took place earlier this month, and that was coordinated with APHL as well as with HRSA, to really be able to get more information directly from state programs, people who are really dealing with the system on a day-to-day basis, both from the laboratory perspective and screening, but also from the short-term and long-term follow-up components. And we also continue to really expand that and to see what are a range of different ways to be more involved at the state level and getting those perspectives into the development phase of the clearinghouse. Another question that we have is, how are consumers made aware of the clearinghouse? Is it through state programs, medical communities, random web searches? And that's a great question. I will preface the answer to that with the fact that, again, we are still in just the first year of this project. Right now, we really are in the data and information gathering. You know, what do people want? What is most important? Phase of the project, and really looking to see what are the key components. What would be the key components of the clearinghouse? That being said, we have a number of ways that we are engaging consumers in this kind of startup period of the clearinghouse. We have a consumer task force on newborn screening, which is a group that Genetic Alliance has been working with for close to 3 years. That task force has a range of consumer perspectives on it, both people from the newborn screening advocacy community, as well as people who were not very aware of newborn screening prior to their work with us, who either had uneventful newborn screens, as the majority of people in this country do, or either they had a false positive, were identified as carriers, or have interacted with the genetic system in other ways outside of newborn screening. And we really have been speaking with them, this really nicely formed group, to see, where should this be promoted? Where should the clearinghouse be promoted? Is it something that should have a little highlight while people are in their prenatal period and going to their health clinic or their doctor's office to see something that says, at this time, you can find very valuable information around newborn screening at the clearinghouse? Is that one place? Are pamphlets good? It's something that we are still ironing out and gathering more information about in terms of how are other ways for consumers to be made aware of the clearinghouse. And not just the clearinghouse, because though the clearinghouse will have a lot of information, it's not necessarily to bring more attention to the clearinghouse as just the program, but really connecting families to information and knowing that the clearinghouse can be one really great way to make those connections and to get to connect people. But we also will be looking to the regional collaboratives who have different levels of consumer engagement to also work on that component with us from a more dissemination and public education, public awareness perspective. Another question that we have, are there any firewalls between access to screening, blood spots, and law enforcement or other types of investigation? So I will say to that there are different firewalls, and that is really mandated at the state level. That's really as much information as I can give at this time currently on that topic, but we are looking at ways to incorporating more information in the clearinghouse about laws around newborn screening, blood spots, as well as other issues that encompass the newborn screening system. But I would say if someone has more specific questions around that, to really go to their state level officials and to get more detailed information. So let's see if we can pull up the results of the first poll. Okay, so if we recall, the question was, which feature of the newborn screening clearinghouse do you find most useful? And majority of people found that the quick links was most useful, followed up by the featured resources, which is what we expected. Those are the things that have been in place for a long period of time now, since October 2009 when we launched the site, and is part of the main need in terms of why the clearinghouse was created. It will be interesting to see in a year from now or so, when we re-ask that question, how that may play out. And I think we now have the final results. I was giving everyone a sneak peek to the second poll, but I think now we have the final results for the second poll that we did. And the question was, which topics would you like to see? Which topics would you like to see featured in the newborn screening blog? And the first, again, was news stories or hot topics in newborn screening. I think that's one thing that we're always seeing on, or we're seeing more so on the news and in the media. So that would be a really great avenue to kind of address those issues is through the blog. Then followed up by highlights of the Secretary's Advisory Committee meeting on heritable disorders in newborns and children. We know that that committee does a lot to try to reach out to people and to have it be fairly accessible through its webcast, but this is also, I think it would be a really great way through the blog to get different perspectives and to share some of the highlights of that meeting. And then that was followed up by stories from affected families, and that's something that we also have been looking into in terms of really giving the stories of newborn screening. There's a lot to the newborn screening system, but all of it is really about the families. And we are really excited to kind of work with the Consumer Task Force as well as other advocacy organizations and other families both at the state, regional, and federal level to get those stories out there and to really give a face to newborn screening. So great, thank you to everyone for filling out our slightly unofficial polls. But the next webinars that we have coming up are activism through documentary films, and then after that, an adaptation to a genetic condition, recent findings with living with some conditions. I can't read the whole slide, but that's okay. But I would like to thank everyone for participating in this call and giving us your feedback on the polls and also your questions. It may seem like something very simple, but we really do take all this information back to the clearinghouse team to see how we can incorporate the feedback we've received from you, our listeners, our participants on the webinar, back into the clearinghouse, into the program, as well as back into all the other newborn screening initiatives at Genetic Alliance. I also would like to say thank you to Lainey Simon for opening up the presentations today with your kind of setting the stage of what the clearinghouse means to HRSA and furthering along that initiative. And without further ado, thank you everyone for participating on the call. We hope that you will join us for our other webinars later this month. And if you have any questions, please feel free to contact us at Genetic Alliance. And have a really great afternoon. Thank you.